Welcome to the World News Disease Report. Today's story will cover how human responses to illness have changed over time. It is February 2014 in Sierra Leone. Ebola has already taken the lives of over 11,000 people. Doctors in the countries of Guinea, Liberia, and Sierra Leone are frantically trying to find a cure for this deadly virus. The virus is transferred to people from wild animals and spreads through direct contact to a vector or carrier. The first Ebola case appeared in 1976 in South Sudan, in the Ebola River where the virus gets its name. The Ebola virus causes an intense, serious illness which is fatal if not treated. Some of its symptoms are fatigue, fever, dehydration, and internal bleeding. These are real victims, and these are their stories.
Doctor, my chest hurts. I'm coughing up blood and it's cold. How long do I have?
We haven't found a cure yet, but we're trying as hard as possible to find one.
Is there anything we can do at this point, Doctor?
There isn't much time left for him. At this point, we just need to make him comfortable.
Wait, Doctor, I think he's flatlining. We should go and check on him.
Okay.
I think he's hemorrhaging. What do we do?
Lay him down flat and wrap him in the towel to suppress the bleeding and immobilize him. He's dead.
Time of death, 3 o'clock.
There are not any known cures for Ebola, and there are currently no approved vaccinations. Although, according to the World Health Organization, there are several promising vaccine candidates that have been shown to protect non-human primates against the lethal infection, though they have not been cleared for use on humans. Unfortunately, this patient died from a hemorrhage, common for Ebola victims. Symptoms are pain in the abdomen, chest, and the joints, fever, fatigue, and of course, loss of appetite. Eventually, patients may have internal bleeding, get diarrhea, nausea, and vomit. In the end, the victims hemorrhage, but in some cases, patients have survived due to experimental vaccines.
The year was 1340 medieval Europe. The Black Death has affected 450 million people across Eurasia, which is about 60% of the population. It's spread by infected fleas and rats. Deriving from China, the bubonic plague, nicknamed the Black Death, spread throughout Eurasia through Mongols traveling on the Silk Road. The specific name of the bacteria is Yersinia pestis. According to Giovanni Boccaccio, an Italian writer from Florence, the plague has led to mass deaths and burials of citizens. It's resulted in mistrust in our local doctors and in church itself.
Muscles and my fingers are turning black. Also, one of my bums exploded again.
Well, there's not much we can do besides make you comfortable because there's no cure for this. So you're kind of done.
Doctor, how much longer does he have?
I would give him an hour or so, not much more.
1 hour later.
Doctor, the patient's dead.
Time of death is, I think, 7 o'clock, maybe? Just get him out of here.
There are no cures to the Black Death. Some of its symptoms include pain in abdomen and muscles, fatigue, nausea, and diarrhea. The plague causes delirium, shortness of breath, and painful lymph nodes. The bumps grow in the skin and split open, releasing pus and blood. The medicine world has no antivirals available to patients to help aid the recoveries. The Black Death results in painful, slow death.
But had tragic losses, but only one had a vaccine to stop it from happening again. The unsanitary environment of the crowded European cities that were affected by the disease also contributed to the rapid spread.
The bubonic plague had no cure or vaccine to help the people, but Ebola had a vaccine. This is thanks to the advancements in medicine we have made over the past years. We have more resources now than we had back then. The frantic scramble to create effective Ebola vaccine proved the efficiency of the disease control industry. Resources that people did not possess back then when the bubonic plague started.